Good afternoon, everyone. I'm very thankful to Shekhar sir and Swara family for giving me such opportunity to present my case here. And today I am presenting a case of 36-year male patient having a complaint of ringworm, dandruff, and headache since 5 years. And the case verbatim of the patient, I said, yes, tell me please. He said, ma'am, I have a ringworm in my beard area. I used to apply ointments since 5 years. After applying it, it gets disappear for some time and then return back as it is after 1 month. Almost 4 to 5 years pass like this. Now I want to recover from this permanently. So I came to you. I said, continue. Patient says, I also have a lot of dandruff since 5 to 7 years. And one more thing, I have severe head pain complaint since long time. Whenever head pain starts, I took painkiller because only painkillers give me relief that time. And sometimes I have to take an injection also. I say, okay. Allopathic doctor says, due to numbers or glasses, I have this head pain. So I brought a glass, but never wear it. Then I think something strange. I said, why? The patient said, it doesn't look good on me. I took other prem also, but that one also not looking good on me. So I am not wearing. So I probe here very again and again, but nothing came out. Then he said, I have a dandruff since long time. I said, okay. Then I asked him, what is her profession? I am a raddiwala. Raddiwala means पस्ती बेचने वाला और खरीदने वाला. So that time I look something in his eye. So I said, how this ringworm is affecting you? In very mild, gentle voice, he smiled. Said, it don't look good on me. If anyone notice it, it's embarrassing for me. Even myself also doesn't like to see in mirror also. I feel embarrassing. Saram aata hai. If anyone notice it, then he said, I used to wet my head so that no one can notify it. In beer area, I do apply ointments as soon as it starts reappearing. वो बोला था जैसे ही वापस आने लगता है मैं तुरंत लगाने लगता हूँ ointments ताकि वो तुरंत चला जाए ताकि कोई देखे नहीं. तो I said, when someone notice it, then what happened? He said, nothing, with mild smile. What will they think? So he said, nothing. Again, nothing. I thought, yes, they are noticing me. Although they are not noticing me. मुझे लगता है कि वो लोग नोटिस कर रहे हैं मुझे, बट ऐसा होता नहीं है, बट मुझे लगता है मैम. Then he said, I don't like it. In my mind, I thought, what they are thinking about me? I am infected with some infection, and after that, they might be avoiding me. वो मुझे अवॉइड करना शुरू कर देंगे, जैसे मुझे कुछ स्किन की परेशानी है, बीमारी है. I said, okay. Then they might thinking about something, new disease, and start avoiding me, start making distance from me. वो मुझसे दूर होना शुरू हो जाएंगे. By nature, I like to talk less. I am talk only when it is required. I don't like to quarrel. I avoid it mostly. इस केस में बहुत बार अगेन एंड अगेन प्रोब करने के बावजूद पेशेंट ने इतनी माहिती दी है, आगे वो बोलना ही नहीं चाहता था. सो आई से ओके कोई बात. बाय ऑब्जर्वेशन patient is very mild, gentle, look proper, and iron clothes he wear, proper haircut, neat and clean clothes. So this strikes to me, he is a paper wala, raddi wala, and he is highly conscious about his look. So my analysis is, हाउ दिस पर्सन इज, कैसा है ये पर्सन, वेरी माइल्ड, जेंटल, लुक वाइज प्रॉपरली नीट एंड क्लीन प्रेजेंटेशन. And what is his profession? Raddi wala. What is bothering him? Ringworm on the beard area, which is quite visible. And what he is doing? Hiding or avoiding by applying ointments, by wetting heads. And what he feels? Embarrassing. Why? If they notice it, and then they will think something about him, after that, they avoid him or ignore him. इतना ही था इस केस में. Then till now, since 4 to 5 years, what he is doing, just applying ointments for time being, that not visible to anyone. So the concern is look. कभी उसने दवाई स्किन स्पेशलिस्ट पे भी नहीं लिया कि वो ठीक हो जाए. उसका कंसर्न था कि दिखना नहीं चाहिए, इसलिए ऑइंटमेंट अप्लाई करता गया. So the repertorial chart is elements from embarrassment, hiding himself, proper to, and fear rejection of. लोग मुझसे डिस्टेंस बनाने लगेंगे, मुझे अवॉइड करने लगे. तो मेडिसिन केमिस्ट and step is agreed. The level of experience is definitely fact level. The medicine given is Netramure 30 single dose. And after medicine, materia medica understanding, Netram person is a very emotional vulnerability leading to introversion, close person. दे जल्दी से ओपन नहीं होते, अपने अंदर की बातें बताते नहीं है. Avoid being hurt or to hurt others at all cost. Tries not to show emotions, to maintain control over their circumstances. Very fastidious. Turn to emotionally safe activities like reading, music, great sense of responsibility, loyal in relationship, can appear cold at distance, and aversion to company. In a skin area, from Ellen Skinnott, itching, eruption on the margin of the hair at the nape of the neck. Eruption like nettle rash after violent exertion. Eruption like ringworm with itching, aggravation from birth. So after 15 days, he came, and date is 18th March. There is no dandruff, no itching, no headache, no any episode of headache. So I continue SL 15 days. Then again he came after 15 days. 3rd April, he said again overall better, but before 2 days some itching is there. So I continue SL, nothing. And today morning he is also coming in clinic, and he says, ma'am, before 2 days I have 1 episode of headache, but there is no itching, no dandruff, nothing, almost clear. So today morning I repeated Netramure 30 single dose also. जी सर जी बोलिए, कैसा है अभी? क्या क्या होता था बताओ ना. दाद होता था, डेंड्रफ था, सर दर्द भी था. हाँ, कैसा है अभी? अभी आराम है. डेंड्रफ जैसा कुछ है अभी नहीं है. सर दर्द वगैरह पहले कितनी बार होता था? वीक में 1 बार होता था. कहाँ पे होता था, क्या होता था? पूरा तो फिर अभी ऐसा कुछ नहीं. दाद कहाँ पे थी? अभी कुछ है, थोड़ा दिखा दो. ठीक है. कितना टाइम हुआ यहाँ पे? 3 महीने.